Please start your presentation.
Okay, thank you, Yana. So, hello, everyone. My name is Aubrey Villalobos, and I am the Director for Comprehensive Cancer Control at the George Washington University Cancer Institute. Thank you so much for taking time to hear from us today at the end of your conference. We really appreciate it. Today, I'll be sharing a little bit about our CDC-funded work with Comp Cancer programs. The GW Cancer Institute was founded in 2003. We're located in the heart of Washington, D.C., and our vision is to set the standard for patient-centered care and eliminate cancer health disparities. Our mission is to ensure access to quality patient-centered care across the cancer continuum through community engagement, patient and family empowerment, healthcare professional education, policy advocacy, and collaborative multidisciplinary research. In 2013, we were awarded a cooperative agreement from the Centers for Disease Control and Prevention titled Enhancing Implementation of Comp Cancer Activities. It's a 5-year award to provide technical assistance and training opportunities to support the National Comprehensive Cancer Control Program grantees and their partners. As you know, Comprehensive Cancer Control is an integrated and coordinated approach to reducing cancer incidence, morbidity, and mortality through efforts across the continuum. CDC started this program in 1998 and now supports programs in 50 states, the District of Columbia, 7 tribal groups, and 7 U.S. Associated Pacific Island jurisdictions and territories. In 2013, we conducted a needs assessment which showed that there are many current technical assistance resources, but they're not always accessed by the programs and coalitions, they do not fill every gap, and they need to be better organized and promoted. There's tremendous opportunity for collaboration and cross-promotion in technical assistance, both across the cancer control programs and coalitions, across the national partners like the American Cancer Society, C-Change, NACCHO, and Livestrong, and through area health education centers. This slide shows the topics of highest interest among the survey respondents in our needs assessment. They include evidence-based practices and interventions, cancer and chronic disease prevention, grants, funding, and capacity building, policy, systems, and environmental change, and survivorship. Based on the needs, our strategies include communication and coordination of technical assistance efforts, professional education and training, providing tools and resources, providing support for cancer and chronic disease integration efforts, and enhancing connections across stakeholders. This image shows some of the resources and activities that we have undertaken to meet the documented needs. I will go into more detail in the next few slides. Our technical assistance portal can be accessed at www.cancercontroltap.org. This website includes archives of our webinars, access to our e-newsletter, a calendar of events, our information and contact, and other resources. One of our most popular web resources is our searchable resource repository. Here you can search by keyword, year, resource format, topic, publishing organization, location, or population. Filtered results appear that match your search. You can also submit your own resources and success stories on the top left. We also publish a monthly TA Roundup newsletter. You can subscribe to receive our newsletter, which highlights upcoming events, funding opportunities, coalition spotlights, and new resources added to the repository, and so much more. You may also be interested in our web-based training and education. We offer both quarterly webinars and online courses. Some past topics that we've held for webinars include effects of the Affordable Care Act among cancer survivors in the U.S., national partnership support to comprehensive cancer control coalitions, cancer program partnerships with area health education centers, and our next upcoming webinar in January will be about cancer plan development and monitoring. Our online trainings that are going to be released very soon include an executive training on navigation and survivorship program development and administration, and one on patient navigation that's competency-based. In the future this year, we're planning on releasing a course on communications and media planning, as well as on cancer policy. We design our resources to make your jobs easier. One of our resources are social media toolkits. These kits target specific awareness months. Recently, we released both a breast cancer kit and a lung cancer kit and have other kits planned for 2015. The toolkits explain social media basics and provide a mini tutorial on media management and best practices. They also provide sample Facebook and Twitter posts that you can use in your promotion to your followers. Our Ask the Expert series provides a forum for a small group of 12 to 15 attendees per session to ask questions and discuss with a subject matter expert in a very private setting with a webcam and small group situation. The discussion and sharing of experiences among participants is encouraged, and our first Ask the Expert was held on October 21st on the topic of policy systems and environmental changes and the Affordable Care Act, and there is a summary available posted on our TAP website. Our recently launched Expert Database is a technical assistance matching system to facilitate peer learning and new connections in comprehensive cancer control. This slide is a diagram that shows how it works. Individuals like yourselves volunteer to share their expertise and join the Expert Database. These self-identified volunteers in the database have a solid knowledge or expertise in certain topics related to cancer, public health, research, or special populations, and are willing to be contacted to help someone and want to make a difference in cancer control. If you're interested, please join on our website. If you need technical assistance, you can request technical assistance from this peer database by submitting a request, and GW Cancer Institute will look for a match in the database who meets your need. If there's no match, GW will provide the assistance. But if there is a match in the database, we will connect you by email with a peer who can help you answer your question. You'll see up in the top left-hand corner of this slide the website to sign up if you would like to volunteer your expertise in the database. Once we have a solid number of experts in the database, we will be able to start taking requests for assistance. We encourage you to come to our website and sign up for our e-newsletter to learn about all of the activities that we have going on and all of the resources. We also hope that you will send us an email to cancercontrol@gwu.edu. We want to help promote your great work and success, so please let us know what you're up to. And help us be more helpful. We want to hear your suggestions, ideas, feedbacks, and requests so that we know how we can best meet your needs. Thank you again so much for taking the time to listen to us today. And I'm now going to pass it over to Kanako Kashima, who is our Comprehensive Cancer Control Research Assistant, and she's going to give you a tour of our website and share a little bit about social media basics with you. Thank you so much, Aubrey, and thank you all for having me. I'm going to switch right now to my screen so you can see my screen as I take you through our Cancer Control Technical Assistance portal. So this is the GW Cancer Institute's Cancer Control Technical Assistance portal, or we call it Cancer Control TAP. We launched this in September, and this website is designed to pull together existing and new technical assistance for comprehensive cancer control. I will guide you through this website and its basic functionalities today. So on the left-hand side right here, you will see the menu where you can access the various components of the website. I will delve further into these sections in a moment. Here's the subscribe button to sign up for a monthly e-newsletter. Click on this button to be taken to a page where you can fill out very basic required information. Here we feature the most recent parts of our e-newsletter on this left-hand side right here. And here we also have some featured resources that we have in the repository right now. You can access the resource repository by going to the left-hand side menu, clicking right here. The resource repository allows users to search for and access comprehensive cancer control resources produced not only by the GW Cancer Institute, but also by the National Comprehensive Cancer Control Programs and their partners, cancer control coalitions and their stakeholders, etc. Resources include reports, toolkits, fact sheets, and infographics, as well as sample program plans and guides for developing new programs. You can type in keywords for your search, and you can also search by year, as well as searching for certain formats. If you would like to select multiple formats, hold down the control button on your keyboard and select the multiple formats. So if I wanted to do articles and fact sheets, I would click on articles, press down on the control key, and then click fact sheets at the same time. And as you can see, I have made multiple selections. If you would like, as you can see, if you would like to select different criteria and different categories, the search will return resources that fit all of your criteria. So let's do a sample search. Let's say we want to do a search for something on chronic disease in the Pacific Island jurisdiction. What I would do is click on chronic disease in the resources area. So I would look for chronic disease. And I would also go to target population, target location, and click on territories. And click apply. And at the very bottom, I have returned 2 resources that fit my criteria search. If I click on one of these, I would be taken to a page where I would be given a more detailed description of the resource and also a link to the resource, which will take me to the main resource page. There you go. So that is how the resource repository works. If you would like to submit your own resource as a part of this resource repository so other people can search for them and access your resources, please fill out this very basic form, and it will come to us in a submission, and we would gladly add it to the resource repository. The Submit Your Success Story Here button on the right is for the same functionality where we're asking a lot of our comp cancer programs and partners to submit their success stories so that we can disseminate them widely across our partners. Now let's look at the section on webinars. This button right here on the left will take you to webinars. Right now, the GW Cancer Institute does not have upcoming webinars, but you can access past webinars by clicking on Webinars Archive. As you can see, we have a number of webinars that we have put on in the past, and you can access webinar recordings by clicking on whichever recording that you're interested in. Scroll down to the bottom, and you will find there the webinar recording, the webinar slides, and also if you would like to participate in a Q&A on Research to Reality, the link is there and available for you as well. Now let's look at the e-newsletter section. The GW Cancer Institute publishes a monthly technical assistance periodical that highlights new webinars, trainings, events, resources, and funding opportunities. You can see the archived newsletters on the right here. Now let's look at the events section. The events section houses all meetings, conferences, and webinars on comprehensive cancer control by organization other than the GW Cancer Institute. You can also look at the past events by clicking on the Events Archive tab here. The calendar is a one-stop shop for all webinars and events. So you can click on any of these upcoming ones right here and find out more and have access to the registration page, which is, you can go through that with the button right here on the right. I also want to talk about Ask the Expert. We have an Ask the Expert session coming up in December. As Aubrey mentioned previously, Ask the Expert is a small group blood-based session where an expert will answer questions on a particular topic and you'll have the chance to talk with peers that have similar issues. So this one is coming up for December the 10th from 1 p.m. to 2 p.m. Eastern Time. participants will be able to have the chance to talk to Dr. Sarah Birkin about survivorship care plan surveys. And finally, I want to show you the About section, where you can find out a little bit more about how this website came to be, as well as our projects on comprehensive cancer control. You will also find information about the CCC National Partners on the right, and our contact information is also at the bottom, so you can contact us anytime. If you have any questions or feedback about the website, please email us. And thank you again. We hope that this cancer control tab would be useful for you and your efforts. I have also been asked to give you an overview of social media and its uses in comprehensive cancer control. I want to start off by talking about why we should use social media. According to Pew Research, as of January of 2014, 74% of online adults use social networking sites. This is quoted directly from the CDC's The Health Communicator Social Media Toolkit. Social media can connect millions of voices to increase the timely dissemination and potential impact of health and safety information, leverage audience networks to facilitate information sharing, expand reach and include broader, more diverse audiences, personalize and reinforce health messages that can be more easily tailored or targeted to target audiences, facilitate interactive communication, connection, and public engagement, as well as empower people to make safer and healthier decisions. Social media tools include, but are not limited to, buttons and badges, online video sharing, blogs, Twitter, and Facebook. The social media toolkits from the GW Cancer Institute focus on Twitter and Facebook, since 19% of online adults use Twitter, as well as 71% of online adults use Facebook, according to the September 2013 Pew Research. So what is Facebook? Facebook is a social networking site that allows people to create personal profiles and stay connected with others. Companies, organizations, and institutions also can create Facebook pages and become integrated into individuals' network and newsfeed. Twitter is an online social networking and microblogging service that enables users to send and read short 140-character text messages called tweets. It is used by millions of people, organizations, and businesses to discover and share new information. This graph shows data from Pew Research Center's survey conducted in 2010. As you can see, Twitter will be useful for reaching a younger audience, while Facebook has a following among the middle-aged population. Knowing this, you can tailor your health messaging to your target audience and focus on which social media channels to use for your various campaigns. For example, if I wanted to reach preteens about HPV vaccinations, I may want to focus on using Twitter. If I wanted to reach parents about HPV vaccinations, however, I may want to focus on using Facebook to disseminate my messages. As I mentioned in the previous slide, Facebook has a massive number of users, which translates into more opportunities for local to international exposure for your content. It is also constantly evolving, as there are numerous applications that integrate with Facebook to increase its standard functionality. It is also relatively easy to start, as people can get a Facebook page set up in a matter of minutes. However, the challenges lie in maintaining your page. Having an inactive page can reflect poorly on your organization more than not having a page at all. You have to make your content consistently interesting without bombarding your audience with information. This effort takes time and considerable planning. If the planning and messaging is disinteresting, this may lead to people removing your updates from their feed. Twitter can be effective under low budget and time constraints and provides access to millions of active users. In addition, media and news outlets are looking to Twitter as a live feed of events and information, as is the general population. Being a part of this feed and conversation enables you to engage and disseminate ideas and issues as they develop. The challenges of Twitter lie in that you are competing for the attention of your consumers with others in their feed. Maintaining an active, engaging presence, again, on Twitter will require time for listening, research, and posting of relevant content. Maintaining support for your social media strategy depends on how well you can demonstrate the impact of your social media efforts on the goals and objectives important to your organization. Metrics are important to your social media strategies. Metrics are important to who your social media strategies reach so that you can demonstrate value and leverage ongoing support. Say the GW Cancer Institute wanted to establish a campaign to push for the use of the resource repository that I talked about on the Cancer Control TAP website. The campaign strategy would be to engage CCC practitioners and stakeholders with new resources added to the Cancer Control TAP resource repository to increase traffic to the TAP website and repository. I will achieve my overall goal with 3 hours of staff time per week. This duration of this initiative will be 1 month. So how do I measure my effectiveness? Google Analytics is free for use for any sites that have less than 10 million users, which is a lot. It can be installed as a widget for websites, including Facebook, and it gives you a comprehensive look at how much traffic your site is getting, general demographics of your users, such as location, what browser they're using, which pages they are looking at, and how many clicks, what they click on, and more. Google Analytics will even track whether users who accessed your site was referred from your social media accounts. As you can see on this page, the GW Cancer Institute's Cancer Control website has been accessed by social media users 52 times since the website launched in mid-September. More specifically, our Twitter users have accessed our site 40 times. This is a great way to show the effectiveness of social media as a way of driving traffic to your site. Facebook Insights are also available for users after the first 30 people like your page. You can access the growth of your number of likes, look at the reach of your post, which is the number of people who saw your post, and engagement, which is the number of times people interacted with your post, such as liking your post, commenting on your post, and clicking your link. These metrics are valuable for identifying how your posting activity encourages the posting and sharing of others. Twitter allowed users to access analytics in July this year. This opened up a wealth of information that is helpful to access which messages were effective. Engagement rate is particularly important as it assesses the percentage of people who engage in your tweets, as in click on your link and share your or favorite your tweets out of all of the people that saw your tweets in their feed. Klout is an online free application that tracks the influence of your posts to the rest of the online community. Klout scores are measured through, for example, if it was for Facebook, mentions, likes, comments, subscribers, how many friends you have, etc. Klout will also show you a summary of your best content from the previous 90 days. This will allow you to take note of what content generated action from your audience. Klout score is a score between 1 and 100 that measures your users' overall influence on 7 different networks. It looks at your audience and who they are sharing your information with. In summary, social media can be used as an effective, low-cost medium to reach your audience, and the impact of your campaign can be measured. With all of your analytics, your campaign can be adjusted to fit your target audience and campaign objective. Here are some resources mentioned in this presentation that you may find useful to refer back to. Both and more are available in the Cancer Control TAP resource repository as well. Aubrey, I'll pass it back to you. Great. Thank you so much, Kaneko. I just want to mention to everyone that you have a copy of our November Lung Cancer Awareness Social Media Toolkit on the disc that Janos is providing, as well as a copy of these slides. We are also recording this presentation today and will provide a link to the archive to Janos after the call. Janos, I'd now like to open your mic and ask you if there are any questions. Janos, are there any questions?
Wait, do you guys? Oh, yes, I think we have a live feed now. Okay. So I'm going to ask the audience to see if we have any questions. I see one, so we're gonna try to see if you guys can hear us directly.
Would you have the information of social media usage in the Pacific?
I'm not certain if you guys have heard the question, or I should. Okay, so the question was, do you guys have any information about social media usage in the Pacific?
We don't have that information on hand at the moment, but if you give us some time, we can try and find out if the Pew Research Center has that information, and we can send the link along, but I apologize, I do not have the information on hand.
Okay, are there any more questions? No? Wait, there's one. Neil Palafox.
Is it technical assistance that they provide on-site, or just distance you call it? Can they send out someone?
The question is that the technical assistance you provide, is it on-site or over the internet? You can actually send somebody out to the Pacific, or this is more like an internet-based and you guys are located in Washington?
Sure. So mostly the technical assistance that we provide is through the internet, through online trainings, webinars, courses, and the development of tools and resources. For our one-on-one technical assistance, so far it's mostly been by email or phone. We don't specifically have a budget for travel to sites such as yours, but it would be something that we would be willing to look into if you have a specific request, and we could look into it.
Again, we're going to have a couple of days of overlap. If we get the registry carried forward, we'll have a couple of days overlap, but the way that the overlap would work is when we have the verbal autopsy training, it would be more the physicians and the registrars. And so then that would leave the colon cancer coordinator folks available to do something a little bit more specific towards comp cancer program or other, less kind of clinical things. So if they're available, would there be interest, I guess, in having either an in-person or a more focused training, like at the computer lab or something like that, on anything that these guys could offer? So with the social media development or tracking, I know there's not a lot of, in most jurisdictions, there's not a lot of IT expertise that can help with some of these very simple and free ways to to do this. And since it's required of both the CompCancer and the REACH and the NCD programs, I put that out to you folks to see if you'd be interested. Yes? Okay, they said yes.
People are saying yes, so we're gonna figure out the details later on then.
Okay,
Are
any additional questions? If there are no additional questions, I would just like to say thank you again, and we will end the webinar.
Thank you very much on our side. And again, although we already thanked you guys, again, my mic got disconnected. So let's hear it again for Washington University. Thank you.
Thank you, and enjoy the rest of your meeting.
Thank you.